Hello, good afternoon, everyone. Welcome to the third live chat session with Yusrin. I'm Dr. Vincent Ng from Life Care Lifestyle Aesthetic Clinic. I'm happy to be here today to discuss more about the atopic eczema. Today, mainly, we'll be covering on the causes, trigger factors of atopic eczema. Like usual, we'll start off with a session of lecture, which will last about 15 to 20 minutes. After that, it will be followed by the question and answer session. Once again, Eucerin will be giving away one piece of free Eucerin soothing cream. This is the cream that Eucerin will be giving away. That is worth about 65 ringgit Malaysia to every participant that make comment or post the questions to us. So do not miss this opportunity. Feel free to drop me a question anytime. I'll do my best to answer them. So without any further delay, let's get on to the talk. Before I start with the trigger factors of eczema, I would like to have a recap of what is eczema about. Just a main introduction again, what we've discussed the previous 2 weeks, in case any of you have missed out. Atopic eczema or atopic dermatitis is another medical name for it, is a type of inflammation skin disorder that is associated with the immune system of our skin. It's very common in children in Malaysia, affecting about 1 in every 5 child in our country. Number 2, eczema is genetically linked and also environmentally influenced condition, in the sense that children and young adults tend to inherit eczema and shows the symptom and goes through the cycle when they're young. Usually it tends to get better by a certain age, usually the teenage age, but there is a chance of recurrence. Atopic eczema also tend to predispose, meaning causes the patient to have genetically drier skin than normal individuals, because the skin lacks certain proteins. And it is because of this tendency to have dry skin that leave people people with atopic eczema vulnerable to allergens from the environment. Allergens are things in the environment that react with the skin or anything in our body to cause an allergic reaction. However, those who are sensitive to allergens in the environment are usually the patients that show more severe eczema symptoms, right? Number 4, there is no known cure for eczema. However, there is way for us to control the disease, to induce a resolution, and to maintain it at a resolved state to prevent recurrence. This is actually a lifelong condition, like I mentioned earlier. So patients, as they go along, either with their parents or themselves, they will learn how to adapt and how to avoid trigger factors, which we'll discuss in a little while. This down a little bit, right? And then number 5, there is again no single magical drugs or medication that can cure eczema. But in a way, there are many available medications that can help, starting from basic moisturizer like soothing cream as such, right, to topical corticosteroids of varying strength, to oral medications, antihistamines, to some steroids, and also some immunosuppressants. Number 6 is again what I've spoken earlier. This point I'd like to stress out to patients who have eczema so that they do not get disheartened, because about 65% of patients with atopic eczema shows less symptom when they reach the age of 12 to 15 years old. And it is at this point of time that patients need to learn how to avoid trigger factors that can restart the cycle of eczema attack. So without further delay, we'll go into the topic proper today, which is trigger factors of eczema. All right, so give me a minute here. Okay, once again, there are many trigger factors known to cause eczema. We will go into a few common ones, and all these trigger factors does not mean everybody will have the same trigger factor to cause eczema. Some patients will be more vulnerable to one, others to another, or some may be vulnerable to most of it. So these are the more common trigger factors that we will be discussing today. Um, and these trigger factors that we are trying to cover more here today also has got to do with our theme of the whole talk throughout with Eucerin, that is living in the city and how the city actually influences our skin conditions such as eczema. Right, number one, we'll be talking about stress. Yes, daily stress, work stress, family stress, any form of stress. It has been shown that while stress does not actually cause eczema, it worsens the symptom. It is not yet known why and how exactly stress worsens symptoms of eczema, but one explanation offered is that during time of is it on again? Right. Okay. I'm sorry for the interruption. Good afternoon, everyone. Welcome to the third live chat session with Eucerin. I'm Dr. Vincent